COVID wastewater testing has been a conversation since the start of the pandemic in New York State last year. This is exactly the focus of David Larson, an associate professor of infectious diseases at Syracuse University. But when COVID-19 hit New York State, he started working with SUNY ESF and SUNY Upstate Medical University to implement a statewide COVID-19 wastewater testing program. He spoke on how this program could help rural areas in the North Country.
When I think about wastewater surveillance for rural areas, I think about March of 2020, when everybody shut down, and there was they shut down the schools and the businesses, and we shut down because of what was happening in New York City. We didn't really have an understanding of what transmission was like spread out across the North Country.
Larson said to think of it like a smoke detector.
And so I see the wastewater surveillance almost as like a smoke detector. And if you start to see smoke, then you know that there's a fire that's going to happen. And in here, if it goes off, then you can have some different interventions. You can come through and test people. You can alert the public and different things. On the other side, when you're confirmed that it's no coronavirus transmission in the community, that you can shout from the rooftops and tell people, look, we're looking for it and we cannot find it.
COVID-19 wastewater testing was picked up in Watertown and areas in St. Lawrence County last fall and has been used as an indicator prior to major spikes such as the holiday season. Save the River Executive Director John Peach added how models like this could help seasonal towns throughout the North Country prepare and be proactive.
Tourism, fishing, hunting, the scenic beauty of the area is what really pays the bills along the river. People come to see it, to be part of the river, part of the island community. And if we can assure visitors, residents, tourists, business people, that they are there's minimal exposure to COVID, and I just think it could be a key part to bringing people back into the community and keeping them there.
To conclude, Larson shared his ultimate goal for the program, as this is not the first pandemic he has dealt with in his career.
This is the third coronavirus in 20 years that has jumped over from animals. Right? This is the fourth pandemic that we've had in the last 30 years. Think about it in terms of health security. That in 2020, our health security was breached by the coronavirus. And can we install the systems and have the systems in place to keep us health secure, to keep us safe, so that the event this happens again, we're prepared and we don't have to go through so much pain and disruption in our lives.
For ABC 50 Now in Watertown, I'm Isabella Colello.